Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. I'm glad you're here today because I want to walk you through a medication called Clobetasol, which can be effective in managing severe skin conditions. I know that dealing with chronic skin issues like eczema, psoriasis, or dermatitis can be frustrating and uncomfortable, but Clobetasol is one of the strongest medications we have to reduce inflammation, redness, and itching when other treatments just haven't worked. Clobetasol is a highly potent corticosteroid, and it is created to target the underlying inflammation that makes your skin flare up. It works by blocking certain chemicals in your body that cause inflammation, which helps to reduce swelling, redness, and unbearable itch. When used correctly, it can bring significant relief, but because it's so powerful, it is really important to use it exactly as prescribed to avoid side effects. This medication does come in several forms: cream, ointment, foam, gel, lotion, spray, shampoo, and even a topical solution for the scalp. Keep in mind that the form you're prescribed depends on the area of your body that needs treatment. For example, if you're dealing with scalp psoriasis, you might be using the shampoo. Or if you have thick, scaly patches or plaque of psoriasis on your body, you might be using cream or ointment. It also comes in different strengths, with the 0.05 strength being the most common and potent. For less severe cases, a lower strength, such as 0.025%, may be prescribed. Let's dive into the types of conditions Clobetasol treats. For eczema, which is a chronic condition where your skin becomes red, itchy, and inflamed due to an overactive immune system, Clobetasol can help by calming that overreaction, reducing inflammation and redness, and easing the itching. It is especially helpful for managing flare-ups when other treatments haven't worked, but because it's so strong, it's typically prescribed for short-term use. For psoriasis, specifically plaque psoriasis, Clobetasol is extremely effective. Psoriasis is a condition where the skin cells turn over too quickly, leading to thick, scaly patches of skin that can be painful or itchy. Clobetasol works by slowing down the production of those skin cells and calming the inflammation that causes the plaques to form. It's also commonly used for scalp psoriasis, where it helps to reduce the thick, red, scaly patches that form on the scalp. The shampoo form is especially useful here because it's easier to apply and use it in that area. Clobetasol is also prescribed for seborrheic dermatitis, which causes red, scaly patches on oily areas like the scalp and face. This medication helps to reduce the scaling and inflammation, providing much-needed relief. Another common use for Clobetasol is treating itching caused by a variety of skin conditions, whether it's due to allergic reactions, infections, or simply dry skin. By reducing inflammation, Clobetasol helps to ease the itch and allows the skin to heal more effectively. It can also be used to treat post-surgical eye inflammation, though it is less common. In this case, the ophthalmic suspension of Clobetasol is used to treat inflammation around the eyes after surgery, helping to reduce swelling, redness, and pain. Finally, this medication can be used to treat skin allergies where the skin reacts to certain allergens. It helps to calm down the immune system's response, reducing the inflammation, itching, and redness that comes with allergic reactions. However, because Clobetasol is so strong, it's only used for short periods to avoid issues like skin thinning. Now let's talk about how to use this medication correctly. If you're using the cream or ointment, apply a thin layer to the affected area once or twice a day, depending on your doctor's instructions, but avoid using more than 50 grams in a week. Always wash your hands before and after applying it, unless your hands are the area being treated. If you're using the foam, it dissolves quickly, so you'll want to turn the bottle upside down, press the dispenser, and apply it directly to the affected area. Avoid using more than 50 grams per week, and don't use it on sensitive areas like your face, groin, or underarms unless directed by your doctor. The gel works similarly. Apply a small amount twice daily to the affected skin, being careful not to go over the 50 grams per week limit. Avoid covering the treated area with bandages or wraps unless your doctor says it's okay, as this can change how the medication is absorbed and potentially increase your risk of side effects. If you're using the shampoo, apply it to your dry scalp and leave it on for about 15 minutes before rinsing it out. You should follow this routine for up to 4 weeks, but no longer unless advised by your doctor. The spray is used twice a day, but be sure not to exceed 52 sprays in a day and avoid inhaling it during application. It is important to keep the foam and spray away from open flames as they are flammable, and always store them in a cool place. I want to emphasize the importance of using clobetasol for the duration your doctor prescribed, which is usually no more than 2 weeks at a time. Using it for longer periods, especially in large areas or in high doses, can increase your risk of side effects like skin thinning, stretch marks, and changes in hormone levels. If you do need to use it for a longer time, your doctor will likely monitor you closely to ensure it's being used safely. If you've been using it for a while, do not stop abruptly. This can cause withdrawal symptoms like burning or peeling skin. Instead, talk with your doctor about how to taper off safely. As for side effects, the most common ones include itching, burning, or dryness at the application site. However, in rare cases, more serious side effects like skin thinning, stretch marks, or allergic reactions can occur. If you notice any signs of an infection, such as increased redness, swelling, or pus, stop the medication and contact your doctor immediately. This medication is generally prescribed for adults and adolescents over the age of 12. It's not recommended for young children unless a doctor specifically prescribes it because their skin absorbs the medication more easily, and they're more susceptible to side effects. If you're ever unsure about how to use this medication or if it's safe for you, it's always recommended to speak with your doctor. Clobetasol is a powerful and effective treatment for severe skin conditions, but it is important to use it as directed and for the right duration. You can read more about clobetasol and the skin conditions mentioned on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now.